Hello, my name is Gyanni and I will be covering mechanisms used to control H7N9 virus, also known as influenza A, and host risk factors. There is 4 mechanisms used to control influenza A. The first one is premortal prevention, which minimizes health hazards in general. Examples of premortal prevention would be the following: health promotions and health education programs. Some of this would involve educating farmers on how to properly handle poultry. Another example would be by creating an early warning system where farmers or anybody handling poultry would be aware of influenza A symptoms. The fourth example would be by developing an emergency plan that would assist people with reducing the spread of the virus if it were to break out. The second mechanism is primary prevention, which is used to lower the occurrence of the disease. Examples of this would be testing birds and any other animals involved in agriculture, maintaining clean markets where poultry is handled or where customers are exposed. Another example would be having farmers wear certain attire such as gloves, suits, and masks. Another one would be creating specialized tools for farmers that could prevent physical contact with animals. Another one would be following standardized hygiene regulations. Some of these regulations would involve washing your hands before, during, and after food preparation. The third mechanism is secondary prevention. This involves early diagnosis and prompt treatment, as well as disability limitation. Examples of this would be screening of the virus. The second example would be China's Ministry of Agriculture calling for an improved biosecurity in markets, which means it's forbidding birds from remaining overnight to avoid accumulation of the virus, enforcing market rest days, closures, and regular cleaning, which is essential in responding to the disease, especially in preventing human exposure. The third example is using antiviral medicines called neuraminidase inhibitors that helps make the influenza A symptoms more mild. The last mechanism is tertiary prevention, which means the disease has occurred and has been treated clinically, but rehabilitation is needed to restore the patient to an optimal functional level. Examples of this would be by continuously maintaining sanitary environments. Another example is an organization called the World Health Organization of Global Influenza Surveillance and Response System, also known as GISRS, who monitors the evolution of the H7N9 virus. They also help monitor and prevent other breakouts in other provinces throughout China. Now we are going to discuss the host risk factors of the H7N9 virus. This refers to factors that make people more susceptible to the disease. The first one is race. The Chinese population are more likely to be in contact with the disease because they are involved with slaughtering, processing, and selling of poultry products. Males and females may also be affected by the virus. The median age that is more likely to be affected is 64-year-old men, and this is due to different gender roles. Most of the men are poultry farmers compared to the women who stick to the fields that produce vegetables and rice. Now looking at this map, you can see that the provinces near the Yangtze River, such as Shanghai, are at higher risk of influenza A. The majority of these cases are related to animal environment factors. Thanks to better research, there is fewer new cases in 2017.